Hi, my name is Valeria Martinez, and this is my presentation on the meningococcal vaccine. So, we see that the causative agent for what we call invasive meningococcal disease is a bacteria called Neisseria meningitis. And this bacteria is gram-negative. It is a diplococcus, as you can see in the image, and only 5 serogroups of it cause invasive meningococcal disease, or IMD, as it's commonly referred to. And these are the A serogroup, the B, C, W, 135, Y, and X. And we'll see vaccines for that A, B, C, W, and Y serogroup. However, we do not see a vaccine for the X serogroup. Transmission of the disease comes a lot with sharing respiratory or throat secretions, so through close contact such as kissing or anything else where you're sharing those secretions, and lengthy contact. So we also see this when people are living in close quarters, such as a college dorm or military barrack, for an extended period of time. Diagnosis is normally done through samples of blood or cerebrospinal fluid, depending on the type of infection that you have, whether you have meningococcal meningitis or a meningococcal bloodstream infection, and depending on what the doctors see based off of your symptoms. So we will treat this with antibiotics such as cefotaxime or ceftriaxone, most commonly, but we also see penicillin or ampicillin used on occasion when susceptibility testing is done beforehand. We also see rifampin, but this is only if other antibiotics are not being used. The infectious disease it protects against, so just meningococcal disease, and as I mentioned previously, there are 2 types. That is meningitis, which meningitis and meningococcal disease are not synonyms. A lot of different bacteria and viruses and fungi even can cause meningitis. It is just commonly referred to as the meningitis vaccine because that is one of the main things that it is protecting against is meningitis, which is that inflammation of the meninges around your brain and around your neck. So we'll see a fever, headache, and a stiff neck when one has meningococcal meningitis. We also see meningococcal bloodstream infections, which comes with side effects of like cold hands, feet, diarrhea, nausea without vomiting, fatigue, and fever and chills, among other things. And it is a pretty deadly infection, which is why we try to use the vaccine preventatively. Because with antibiotics, 10 to 15 people out of every 100 infected will still die, and 1 in 5 survivors have long-term side effects, such as neurological damage and even loss of limbs, depending on the severity of their meningitis. There are 3 types of vaccines available in the US from 6 different companies. So the most commonly used one and the one recommended for adolescents is this first one, the Men-ACWY conjugate vaccine. And this protects against the serogroups, as the name suggests, A, C, W, and Y. And we see this used in 2 doses. On occasion, we'll even see another booster. But dose 1 is normally recommended to be at 11 to 12 years old, and the second dose at 16 years old. We also see the Men-B, which is a recombinant protein vaccine and only protects against serogroup B. It is used less commonly because it's not really believed to promote too much herd immunity or to be very effective, and also it only protects against one serogroup. So it would also come in 2 doses. The first one around 10 or older, but normally you would get it like between 16 to 18 years old. And then another less common one is the Men ABCWY, which is just a combination of those first 2 vaccines that I mentioned. So it is a conjugate and recombinant protein vaccine that protects against the most prevalent serogroups A, B, C, W, and Y. And it would come in the same dosage plan as the Men ACWY vaccine. So you get your first dose at 11 to 12 years old and your second dose at around 16 years old. We see a lot of colleges requiring this vaccine, so that's why you get your second dose so much later. Just because of like freshmen in college moving into dorms, such close quarters, that meningitis is a real threat on college campuses. So the vaccines are made from parts of dead Neisseria meningitis. So it's not live. Normally it'll be dead or very weakened. And this stimulates your immune system, making your body produce antibodies against the serogroups that the different vaccines are specifically vaccinating against. They're also all intramuscular vaccines. So we'll see some side effects from the vaccines, which I will get into in a second. So with the Men ACWY, we see 10 micrograms of lyophilized meningococcal serogroup A and some less micrograms of capsular polysaccharides for serogroups C, W, and Y. For the Men B vaccine, since it's a recombinant protein vaccine, we just see like 50 micrograms of different recombinant proteins. And then again, the Men ABC WY vaccine is just a combination of that conjugate and that recombinant protein vaccine. So for side effects of the vaccine, it's just pretty basic side effects that we see with a lot of different intramuscular vaccines. So for the Men ACWY vaccine specifically, we see redness or soreness at the vaccine site where the provider gave the shot. We'll see muscle pain, headaches, or fatigue, or generally just feeling tired after the vaccine. For the Men B and Men ABCWY, the only differences are really that we see swelling where the vaccine provider gave the shot. We'll also see some joint pain, fever or chills, and nausea or diarrhea. And as you can see, this image is just a general stock image of a vaccine reaction, and I got it from the Vaccine Injury Team, which is one of many law firms and law groups that sues hospitals, doctors, or pharmaceutical companies for vaccine injuries. And a lot of the vaccine injuries that they are claiming are worthy of lawsuits are just general normal reactions to having a vaccine. And if you really go on, for example, this Vaccine Injury Team website, it's like a list of reasons why not to get the meningitis vaccine, and most of it is just redness or soreness, inflammation, muscle pain, headache, which are short-term side effects and completely harmless in the end. For incidence of the disease in the United States, since the vaccine has been recommended, we've seen a large decrease in incidence and prevalence of the disease. But we still do see about 1,400 to 3,000 yearly cases, with about 150 to 300 deaths with that. Um, and about 100 to 125 of those cases will be on college campuses because of those close quarters that we see in dorming, especially amongst freshmen. Worldwide, we do see about 500,000 or more cases per year and death in 6 to 10% of those cases. Most of the incidence is in the meningitis belt of sub-Saharan Africa, and as you can see, this like meningitis belt right here, and that's because it's a dry rural area. The population has more immunological susceptibility to meningitis and meningococcal disease. And also, there are a lot of incidences of close living quarters in this area, so that just causes meningococcal disease to be that much more common there. So in more modern times, there was an increase in cases reported in late 2023 and early 2024 by the CDC. Unfortunately, due to the state of things, it's very difficult to find updates on that for 2025. But the people disproportionately affected by this increase included people between the ages of 30 and 60 years old, Black or African American people, and adults with HIV. Um, and we see that due to a lot of post-COVID kind of scare about vaccines and a decrease in vaccinations. Um, so, history of the disease and the vaccine. Meningococcal disease used to be a pretty large problem in military barracks due to close living quarters. And in 1974, the FDA licensed 3 different meningococcal polysaccharide vaccines, only for limited use, although before that, in around 1971, it was being used in military barracks, although the FDA had not approved of the vaccines. We do not use polysaccharide vaccines anymore, and since then, or at least for meningococcal disease, but since then, the conjugate and recombinant protein vaccines have been developed, and it was not until 2005 that the men ACWY vaccine began to be recommended to adolescents, and also again after that adoption of the meningococcal disease vaccine, we see like that stark decrease, and you can see here in U.S. military personnel before and after the adoption is just like night and day, basically. So that is pretty much it. But yeah, these are my references. It is mostly just CDC information that is available on the meningococcal vaccine. And yeah, thank you very much.